You're live.
All right, we are live and this is Cinco de Mayo.
Love that.
And this is Senate Health and Welfare. So you can go do the Macarena afterwards. Nolan, thanks for being here. We're going to look at 938 and the fiscal information that's included in that bill.
Yeah, I gotta zoom in here. Sorry.
All right.
I'm doing it right now. Click them
Good.
coming in. Knocking on the door.
I know we've had this for a bit, but now that we've gone through the bill, we might be able to ask some questions or at least have a different perspective on it.
It's gonna echo, sorry. And one more step in here. Okay, I come bearing gifts.
Good.
I love my sheets, but I did this way because not that I'm pro paper, but I was anti-confusion. So, and it's often easier for you guys to have something to, putter with.
There's
one more.
This is.
Oh, yeah, that's there.
Okay.
All right, so the fiscal is posted again. Really what the purpose of this is to sort of re-highlight the buckets. So on the left side, you have the GovRec. And this is all the different pieces that were in the GovRec. The next column you see is H938 is passed by the House. And you can see we broke it out by base GF, one-time GF, general fund. FF is search for federal funds, and then GC's global commitment, and then total. And then the last column is the delta, which you'll notice. So there'll be some ups and downs throughout, but you notice the bottom line of the delta is zeros. And what that highlights is that the House intended to, as I mentioned earlier last week, which seemed like years ago, that the House was trying to live within the same bucket as the governor. And that the budgets on both the House and the Senate also reflect the same budgets. So the idea is Human Services said, we're going to keep the same bottom line, but we're going to move things around based on our priorities. So you can see, for instance, POP grants. They took 1.1 million out of POP grants or 3 million out of shelter. And they moved it around, so they moved one time to one time, base to base, GF to GF. And they move things around based on what they think the priority should be. So, and now that the budget has passed, the budget passed with the same foundation. So the idea was that you guys can move things around within the bill, say this is where the money goes. But ultimately you want to have the same base GF, the same one-time GF, et cetera. So you get it. So that's what this is here. So you could say, okay, we want to put more into shelter development or less into shelter development. This is your place to do it, but you just have to make sure the bottom lines match up to what you've already passed in your budget.
Okay, so as we go through it, so for one of the questions, questions that we have, I guess, is how the numbers were derived. How do we determine how much we need? I looked at the agency as much as I looked at the House and for their recommendations. One of the larger numbers here, the biggest number, the hotels and motels. And how does that compare with last year?
I don't know. I have to defer to the friendly faces behind me.
The friendly faces. Is there someone who knows what the 2026 budget had for hotels and motels? It's going to do it. Okay. And then eligibility staffing, can you define what that means?
those are the positions that the governor had recommended to do this work, and the House said we don't need that many positions.
So is this for case management, for example, for people who are homeless?
And I will defer to the friendly face behind me.
So okay, I'm gonna ask all these questions and then
Sure.
we'll come back and ask them again. So I see case management under there as another number. And eligibility staffing is another number. I know that eligibility determination is something really important, especially if we have the new definitions and tiers available for different types of housing.
Yes.
You have a number, you have something for me.
I have something on the eligibility staffing. I'm sorry. Good morning. For the record, Miranda Gray, the Deputy Commissioner for the Economic Services Division. And so I can talk about staffing and we're confirming the number. Okay. Motel. So the distinction here is the eligibility staffing are those that engage with they determine if someone is eligible for a GA hotel or motel based upon the criteria that would be in the bill. But then they're the ones that are engaging with the hotels and motels to say, do you have a room that's available? And kind of doing all of that behind essentially booking a room, as any of us would do. So that's what eligibility staffing is doing. And then the other staffing that is mentioned would be those that would be assisting people in the program, making sure they're connecting to services. That's the case management, more on the ground and really assisting people where we're more of the majority of our staff are a contracted call center that help determine eligibility staffing. Or eligibility.
Okay. And then we have permanent family supportive housing here. What is included in that? Are there community organizations included in that for providing permanent and family supportive housing? Or is this the SHA? What is included in that one?
Good morning, Lily Sojourner, Director of the Office of Economic Opportunity at the Department for Children and Families. So that is the two programs that the department manages. One is the Family Supportive Housing Program that is contracts to community providers around the state to provide family supportive housing, which is a combination of general fund and Medicaid fund. And then the second component of that is the Permanent Supportive Housing Assistance Program, which is a relatively new Medicaid budget for adults with complex health needs who are exiting homelessness and receiving that service. And currently that funding supports providers in 6 communities. It's not yet a statewide program. We have capacity for just over 100 households right now.
So if I were looking for my local CAP agency providing shelters, where would I find my CAP agency in this list?
Believe, I don't know. Yeah.
Oh, you need to see the list.
I just want to make sure.
Oh,
That would be under the first row, the HOP. Thank you so much. Thank you.
And the hops?
That would be under the HOP grant
Oh.
operations. That for the governor's recommended, that includes the scope under the Housing Opportunity Grant Program. So that's emergency shelter, transitional housing, coordinated entry assessment and housing navigation, homelessness prevention, rapid rehousing, family financial assistance, homeless management information services, CBE, administration of shelter and services, and training and technical assistance. And then also in the governor's recommended, we included some new specialized shelters, as well as some additional funding to help support natural support connections as another form of financial assistance.
Okay, so there are a lot of questions here. And then how that 40 million is going to be appropriated going forward as compared with the other appropriations, some of which are one time and some of which are phased. And so we need to, we'll come back to look at this in detail, but it would be helpful. I understand that there are linkages with these things within the bill itself, but it's helpful just to keep, ask questions and say, what does this link to? I think that helps everyone around the table. So we'll come back and do that. 9:38 is on our agenda tomorrow, 9:00. So we'll, after we've gotten there, we'll start out and looking, we'll talk with Katie a little bit on some of the markup that we have done. And then we'll, ultimately, we're gonna get back to this. I can't tell you exactly when, see how it flows. That's what we are, I guess we.
I have the answer on the budget for hotel and motel rooms.
Uh-huh.
The state fiscal year is 32.6 million. That's what we budgeted.
It was 26 million
Or-
for the 26.
For 26, it's 32.6 million.
All right. Thank you. All right, good. So, Nolan, thank you for doing this. And we'll have you back in the hot seat soon. Looking forward to it.
No.
That would mean we're getting close to the end. We want to get to the end of this.
Looking forward to that.
So, John, I do have,
Sure,
I have copies of this,
perfect.
so we can jump on to H 657 and a proposed amendment. That came up after we had voted on the bill. I think we had talked about some of it. Yes, that's the stuff. I think there's a couple of it.
I can also screen share if that's helpful, but
Yeah,
I'm
that'd
happy
be
not
good.
to if you don't.
That'd be good. Does
So,
anybody, do you want one? Anybody else need one? No, we're good? Okay, we're good. So we're looking at H 657. We've actually finished 9:38 for the day, but thank you all for being patient and in the room. I know everyone's interested in this. Okay.
perfect. So I'm John Gray, Office of Legislative Counsel as the chair. Forecast that this is H 657, which is already passed out of committee. This is this is an amendment in Senator Lyons' name. Of course, could be updated as appropriate, but this is two little fixes in response to two separate requests, one from the Treasurer's Office and one from DCF. The first instance of amendment, and just for orientation, we're talking about the sections of 657 that relate to Social Security benefits for youth in foster care. And so you'll recall two measures from that. One is that DCF would be required to establish an account for each child who is a beneficiary. And in particular, the language was a trust account, which for children receiving SSI benefits, they would have that qualified ABLE account, which is a tax advantage savings account. The first instance of amendment is striking the requirements that the account be a trust account, and instead just that it be an account. It does not disrupt any requirement related to the qualified ABLE account. That would still be the case for anyone receiving SSI benefits. But for folks who are not receiving SSI benefits, if you're just receiving Title II benefits under the Social Security Act, it wouldn't necessarily have to be a trust account. The request came from the Treasurer's Office. My understanding is it just relates to like administrative practicality of the situation, that it might be harder to withdraw funds at the end. One thing I might note is that it doesn't disrupt anything about the obligation that DCF has to the children as beneficiaries, right? They still stand in that relationship where they're acting to manage the children's funds as they're required to do under the Social Security Act. So it doesn't disrupt that. It just says that when accounts are stood up for folks who are not receiving SSI benefits, they wouldn't necessarily need to be trust accounts. The second instance of amendment is pushing back the effective date for the program. You may recall that sections 2 and 3 for the Social Security benefits for youth in foster care went effective next summer, July 1, 2027. DCF had requested some more time. I'm sure you've heard about the capacities that they have to implement the program. So the idea was to push this back a year to July 1, 2028. And potentially in the interim, you could either develop a phased-in implementation plan that extends the program to different age groups, or perhaps by July 1, 2028, it can just outright be offered. But that's the two changes. One is striking the requirement that the accounts be trust accounts, and the other is just pushing back implementation of the program until July 1, 2028.
So this pushes everything back. It's not one specific age group versus another. And that was something that I had asked for. And I'm open to suggestions from the committee in two ways. One, it could be a cohort by age. And then it could also be January 28, but allowing for DCF to have time to implement, the program that they need, the work they need to do.
So this essentially just offers
Okay,
extra time in which you could develop a
Right. and it will go back to the House, which will also comment. Sure.
I mean, if it must be, then it, you know, if that's what the
It'll
recommendation
help with
is.
that.
Yeah. Be nice to get it done sooner.
I know.
Yeah.
I'm wondering about putting January 1, 2028 in there instead of July 1. We do that.
I'm happy to do that, but if that's what you would like,
Yeah,
the
6
memo,
months.
the memo that I read, the July 1, 2028 figure came from the DCF memo.
Right. I know that.
And so you can change it to whatever you would like. The thing I would of course note is that if you put it at July 1, 2028, and they come back next year and have a plan, you accelerate it.
We can also change it, right?
There's different ways to do it.
Yeah,
Would you like it updated to Jan 1 or?
I'm fine with it at July, but it's also consistent with the budget year. And it also allows for changes that could be made next year. Fine. Okay,
Thank you, guys.
yeah, it's good. I'm just questioning, would anyone else like to sign on to this? Committee members? Okay, because, okay, all right, let's all put
Cool.
the whole crew.
Okay.
And then, John, are you comfortable presenting the amendment on the floor on behalf of the committee? Okay,
First, I thought that was directed to me and I was like,
would you like to?
sure, I'm comfortable with that.
Say you just got promoted
Is it?
or demoted.
Yeah. Don't betray my thoughts.
Yeah. I was,
Okay.
okay. All right, that's good. Thank you all. That's a good thing to do. And then the other one last thing, which is nothing to do with you, and I thank you very much for being so available. Really important. That 816 that will be up on the floor tomorrow. There will be a proposal amendment that I'm working on with, Senator Hashim. And, it's clarifying language that judiciary had concerns about. Katie, can you?
Sure.
Oh,
It's with the editors right now, so I can't pull it up.
very good.
But it has language, in subsections B and C of the big section, which is section 3 of the bill. It removes a reference to an individual, because an individual who's not certified, licensed, or rostered as a mental health professional, because, there was an interpretation read into it that a parent who's trying to assist a child struggling with a mental illness, maybe some of the things they would say to the child would fall within a mental health service definition, and you would want to subject that person to enforcement by the AG's office. It was really meant to target chatbots. So individual has been removed, and then subsection B itself has been rewritten as a result, in part of pulling out that language. So I have it written in my notes. Hang on. Mental health services shall only be provided in Vermont through AI if a mental health professional reviews and approves the AI generated output prior to the information being transmitted to the patient, client, or AI user. So that does 2 things. One, as we talked about, it requires the mental health professional who's using AI as a tool to review and approve any content or output before the patient or client receives it. Also, if there is a entity that is hosting a chatbot and it's being used in Vermont to provide mental health services as defined in the bill, that would have to be, any output would have to be reviewed by the mental health professional before it goes to the AI user. Meaning that there would have to be, maybe the IT company is hiring a mental health professional licensed in Vermont to review
that type of output before it goes to the user. I don't know how that would be implemented per se, but there would have to be that review before a client sees it.
Got it.
Can we go over it tomorrow with the language in front of us?
Yes, yeah, we'll do that. We don't have it yet.
Yeah.
We'll do that, when Katie is in here with us. We'll have time to do that and it'll be before we go up on the floor, so we'll get a. And I don't know where this is.
Probably just be helpful, because I'm not sure.
Yeah, it's hard to do it.
I don't know.
There was just a heads up for you that there will be an amendment. And, I think judiciary is very interested in it as well, so we'll make sure that it corresponds to the work we've been doing. Okay, thank you all.